And next, how minimally invasive surgery changed this mom's life and helped her get back to all the activities she loves, including marathons, running, and swimming.
Welcome back to the Morning Blend. Well, for many women, robotic surgery is a great choice for gynecologic procedures. Today, the story of one very active mom who says that type of minimally invasive surgery changed her life.
Dr. Amar Jaglan is an OB/GYN with Aurora Advanced Healthcare. He's here today with one of his patients, Kristen, who is very, very active, but you were having some issues with cramping and bleeding, and that can really inhibit what you can do. At what point did you know it was a problem you couldn't deal with anymore and you needed a solution?
I started noticing after my third child that the pain and the bleeding was not tolerable any longer. So that's when I consulted with Dr. He was my obstetrician and gynecologist. So I consulted with him and I told him, I said, I need a solution that's going to get me back, because I've got these races scheduled and I've signed up for them, and being on the sidelines isn't really an option for me. So he recommended this procedure.
Let's talk about how active you were, because we're both impressed. You've run 20 marathons
and 2 Ironman. That's unbelievable.
Races. That's incredible. I mean, you're extremely active. Do you run every day?
Not every day. I run generally 3 to 4 times a week, but swim at least 3 to 4 times a week too.
Wow, that's a lot.
And then the cycling you add in as well if you're training for an Ironman.
Correct.
And for people who don't know, an Ironman is 100 miles, right?
112 miles.
Oh,
well, 140.6 miles altogether, but
2.4 mile swim, 112-mile bike, and then a marathon. In case you're interested, Mom.
Yeah, the marathon's at the end. You just top it off with the marathon at the end.
Just a quick 26.2.
I mean, that's a lot, doctor. That's an extremely active patient.
Extremely active. You know, when Chris had approached me with her symptoms, she didn't want a long recovery, and she suffered quite a bit from extreme heavy uterine bleeding, pelvic pain, severe dysmenorrhea with her cycles, and she's extremely active. And so after a workup was undertaken, ultrasound was done, it showed changes within her lining of her uterus suggestive of adenomyosis, which is the internal endometriosis of her uterus and her pelvis.
Most people are going to think that's not something you can do minimally invasive.
Correct. And usually traditionally it was done with an abdominal cut or a vaginal surgery. That's usually anywhere from 6 to 8 to 10 weeks of recovery. And knowing what Kristen wanted, and she was already a marathoner, and she wanted to do her Ironman, so we decided on a robotic procedure.
Kristen, how quickly were you able to get back out running and training, and how did you feel in those first few weeks of getting back out there?
I actually completed the Madison Open Water Swim at 4 weeks post-operation, and then I did a half Ironman at 6 weeks post-op.
That's amazing.
In Michigan. So, and then in 4.5 months, I finished my Ironman in Mexico last November.
Do you feel like it's changed your life?
Oh yes, no pain at all. It is incredible. I don't have to worry about planning my life. Not only do I like to train, but I also have 3 children and a very active lifestyle at home, trying to keep track of the kids, and so I don't have to worry about that various times of the month when there's going to be downtime.
Exactly.
And there's not very much scarring in this, which I think if you're an athlete is a little worrisome, because you don't want anything to break or burst, right?
Absolutely, Trina. The robotic surgery, how it came about, was as a minimally invasive procedure. It involves 3 to 5 small incisions. They're keyhole-size incisions. And studies have shown less pain, less blood loss, less scarring, less infection, shorter hospitalization. And usually within 2 to 4 weeks, most of them are doing their regular activities.
One of the things I was reading is that since you initiated the robotic assisted surgery program in 2002, Aurora Healthcare physicians have done more than 4,700 of these procedures. So it's something that, so more and more women are candidates then for this robotic assisted procedure.
Absolutely, Molly. These next 3 to 5 years in women's health, there's going to be a proliferation of robotic procedures. And at Aurora Healthcare, we're the leading in terms of minimally invasive procedure, Da Vinci system. And we've taught numerous other healthcare physicians at other healthcare systems, this robotic procedure.
Kristen, what would you say to other women who are experiencing what you went through? How quickly would you tell them to go to the doctor and have this done?
Well, I mean, it's been life-changing enough for me that I would recommend this procedure, especially considering the alternative, being having a large incision and 6 to 8 to 10 weeks of recovery time. I was back to normal activities very quickly. As a matter of fact, I think at 1 week post-op, I went in to see him, and I said, okay, can I swim now? Can I bike now? Can I run now?
Because you felt that good.
Yeah, I felt that good, and he had never had someone asking these,
that ambitious.
Yes.
Yeah.
So, I mean, he just said, just go easy, and if your body tells you to stop, just stop. So really within a week, I was already, planning the process for getting back to my normal activities.
And most women aren't as active as Kristen.
Correct.
And most women would like to be, but they're
Right.
not. But even for women who are just busy moms,
Exactly.
this seems like a great alternative.
Absolutely. 2 weeks, I usually tell them, give me 2 weekends. We usually do these operations on Wednesdays, are my surgery days. We take 1 weekend off, baby step during the weeks. Second weekend, you can do about 50, if not 60% of your activities.
Amazing.
So,
Yeah, especially when you consider with traditional surgery, people go 6 to 8 weeks or
Exactly.
more in terms of recovery. We're going to put up some information now so that people can find out more about the robotic-assisted surgery program at Aurora Healthcare. You can call the phone number on your screen for an appointment or consultations, 855-800-6447, or you can visit this website. It's aurora.org/GYN surgery. Nice to have you both here. Thank you so much.
Molly. Thank you
Good
for
luck in
having
your
us.
races this
Yeah.
time.
Exactly.